Recording in progress. Do, 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 do.
Let's see you go down.
Oh, are you gonna knit something with me? I love it.
Yeah, I'm sharing a book soon.
How fast can you knit something?
Not fast.
But like, what's a general time frame?
Well, I made this in like 2 hours.
Okay, wow, that's fast.
What?
It's like
That's
2 days,
awesome.
months.
Yeah.
That's fast.
Oh, it's just, I'm like moving to see if I can see the chairs, and it's pointed towards me right now. I'm really smart. I'm really smart at those. Okay, so I'm having both of these are kind of just focused on the chair. So anything to grab. Do, 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 do. Yeah, perfect.
Um,
Oh my gosh, so good. All right. So Catherine, Whitney, and Scott, any questions you guys have? Jump in anytime. Okay. So it's very, very, very professional, very serious. So serious around here. Exactly.
Here.
Wow.
basically, you're getting a
It's so fun. So it's like,
private.
I know, so excited. All right. Are we ready, everyone?
Questions?
Ready for the big time? We're gonna go live on NBC. Okay.
I'm just gonna eat it.
Oh yeah, I'm just making sure your green light's on and my green
Oh, yeah,
light's
Catherine,
on.
if you want cookies, there's a lot.
Or
left over last night.
Yeah,
Thank you so much.
you want a cookie?
Dun, dun, dun. Yes, do you want a cookie before we start? Exactly, grab it before we start. Exactly.
Water. Big fizzies.
Oh my gosh, yeah. It's some fizzies with those, non-alcoholic bitters. It's so nice. It just, like my throat was just a little bit sore. So I was like, oh, let me try it. All right. 3, 2, 1. Woohoo, checking connection. You are now live. Woo! All right. Hello, everyone. Welcome to the second collaboration of Idaho Integrative Wellness and Pelvic Floor, talking about women's health, specifically pelvic floor nutrition. Today, we are again at the beautiful Violet Volumes bookshop in Victor, Idaho. Yes, they do have a website. Buy your Christmas gifts today. And word is they have a 12 Days of Christmas sale coming up. So keep your eyes open. Today's talk, we are talking about pregnancy and preconception. So I'm going to be talking to the crowd primarily. Anyone who's online can send us questions and we'll do our best to respond via our various outlets. So let's start with an introduction. Lindsay.
Oh, I'm Lindsay. I am the founder of Idaho Integrative Wellness, and I do all things nutrition and integrative health. And I'm a prior wildlife biologist here in the Valley I did that for almost 15 years. And this is just like such an exciting series to do, and such a beautiful bookstore, and happy to have all of you guys here. So
Absolutely. And I'm Dr. Kelly Sadauckas, pelvic floor physical therapist. I am a mom of 2 myself, so I've been through the preconception and pregnancy journey. So I'm going to have some individual insights to share as well as some professional ones. So let's get to it, shall we? For the people that are here, how much do you guys know about your pelvis and your pelvic floor?
That's what you taught us last time.
switch seats.
You
have to like accent.
because all I do is just do this. I'll just put my butt to the camera momentarily. It's guaranteed to get extra views,
Yeah.
So I'm getting a lot of, just what we did last time, right? So this is a pelvis with traditionally female anatomy. And we have our low back here and our pelvic bones that form the pelvic ring. In the center of these bones are the 3 pelvic organs. The bladder's in front, the vag with the uterus and ovaries are on top, and the rectum is behind. And the uterus is where all the magic happens that we're going to be talking about today. So, in order for someone to conceive, the birds and the bees, the apples and the trees, yep. There's a lot that's beyond just the musculoskeletal components, but What's fascinating is when conception happens and when the sperm meets the egg, either in the fallopian tubes or the uterus, and then is implanted via IVF, immediate incredible changes start to happen in here. And this little itty bitty uterus that's about the size of a plum in someone who's never had a baby starts to grow and grow exponentially until there is legitimately a human that's like this big in your belly. It's the weird, like it's the most magical thing, but it's also like the weirdest thing in the world. Like the day you have your baby and then you're just like holding this, and it's kind of like an alien. You're like, you were just in my stomach. That's cool, but weird. So for all of that growth to happen, there's a tremendous amount of change that happens in the abdomen and in the pelvic floor itself. As baby is growing, our core abdominal muscles and back muscles, they're having to, and leg muscles, in fact, they're having to support more weight than they've ever had to support before because there's this new human growing. And it's not like it's lifting 20 pounds suddenly one day. It's microns upon microns. But what that means functionally to us is we have to actually be a little stronger and more coordinated as our pregnancy progresses to remain pain-free and fabulous. So that's going to be some of the things that I'm going to talk about today is how to do that well. Additionally, the sweet little pelvic floor muscles, and if you watched our last talk or you've been to one of us in person, you know that these pelvic floor muscles go from the front of the sacrum to the back of the pubic bone. And they're not just one muscle, but there's like more than 13 per side. And astute viewers will recognize this is actually a male pelvic floor. I don't know where I lost my female pelvic floor earlier today, but they're almost the same. We just have one extra hole in the lady pelvic floor. And as baby is getting bigger and there's more weight coming down, if we do not specifically up-train and learn how to coordinate the muscles of our tummy and our back and our legs, the body is going to default to ask the pelvic floor to do extra work. And that's a problem for quite a few reasons. That's why it's common but not normal for ladies to have pee frequency or urgency in pregnancy, for ladies to have pee urges and leaks, because the pelvic floor muscles are having to kind of pick up the slack of these beautiful bigger muscle groups. And then if we think about, hi,
sorry.
you're welcome.
I had a hard time feeding my horse tonight.
No worries, come
Sit
get
in the
cozy,
comfy chair.
small fancy group today. And so we're just talking about the pelvic floor muscles themselves.
Yeah.
Yeah. And if we're pregnant and our cute little uterus is going from like the size of a plum up to the size of a human, it's a big change for our body. And so we need to make sure that we up-train or train the muscles of the tummy and the shoulders to kind of bear a lot of that load so that it doesn't be transmitted to just the pelvic floor. Because if the pelvic floor does too much work all the time, it's going to irritate the urethra and it's going to cause pee urgency and leaks. So those are the big things that we're going to talk about in pregnancy. And then looking towards the delivery, of course, you know, if we want these pelvic floor muscles to stay happy and healthy, my usual analogy is the pelvic floor muscles are like an elevator in a 4-story building, and they're meant to live on the ground floor and call into action to go to the 3rd floor and then back down. If we don't up-train the tummy and the scaps well, and the pelvic muscles start to rest on the 3rd floor, they'll cause all those pees and urgency. But now what's going to happen if baby wants to come out of the pelvic floor muscles and they're so rigid? So it's not only that those tight pelvic floor muscles could cause us some pain and leaks during pregnancy that we want to soften them, but it's also to prepare for delivery when these pelvic muscles need to get out of the way for baby. So that's what we're going to talk about. So let's do it. The title of the talk is indeed Preconception and Pregnancy. So from the physical therapy perspective, the biggest implication or biggest things that you should focus on if we're in the preconception stage is nutrition, which Lindsay's going to talk about, managing any current aches and pains. Because over this beautiful 9 to 10 month period of growing little baby, any ache or pain that I might have is going to be harder to control later on. So I might as well address it now and help my body be really happy and healthy. Learning to connect to and relax the pelvic floor, which we're gonna do today. You're gonna be a pro this time. And then understanding, getting into a regular exercise program, because regular exercise is one of the biggest things that can reduce your risks for complications like preeclampsia, and that can set both you and baby up for good mental health now and forever after. So this is the time to kind of develop that program in preconception and even in pregnancy. It's huge. Let's see, and then of course, learning about the different positions for labor and delivery. Preconception specifically, one of the neat things to know about if you or anyone else is having a hard time conceiving is there is special types of belly massage that can improve circulation to the pelvic organs. And under direct treatment of a physical therapist, there have been some studies that have shown in IVF, ladies who have done very specific timed, very specifically massage, this is not just anytime you want, but it can improve the implantation success of the eggs. So that's something that's really important to know. And also the IVF process is stressful. And we talked about in the last talk, stress also leads the pelvic floor to be hypertonic, which causes pain and leaks. So even independently, if we're not even wanting the pelvic floor therapist to touch our belly and we're not wanting it for the implantation success, just for managing the body response to stress, it's extremely important. So those are the biggest things from a preconception standpoint. Now, if we want to relax the pelvic floor and connect to it, we can do that all sitting here a little bit right now. So let's do it. Last time I was a better therapist and I brought rolled towels for us to sit on. This time we're just gonna have to use our chairs. So everyone sit with your feet on the ground, please. And your pelvic floor, and Sky, you don't get out of this because you have a pelvic floor. And if you're at home streaming this, you could grab a rolled towel or a cooch ball and put it right under your perineum, which is our fancy name for our pelvic floor, to pre-stretch those muscles. And what we're gonna do is we're gonna put one hand on our belly and one hand on our bra line here. And this is gonna be hard. Yeah, I dropped my vagina. Happens every time.
Fine.
It happens all the time. We're gonna relax our tummies, ladies and gentlemen. And we're gonna close our eyes and we're gonna breathe into our lower belly and back out. This is called diaphragmatic breathing or relaxed breathing. And our first goal is when we breathe in and our belly gets bigger, we breathe out, our belly gets smaller, and our top hand doesn't move very much. And if you've had a stressful day, friends, you might be a little bit of a chest breather or breathing up and down. And don't be mean to yourself, but just say, hey, it's okay. Calm the chest and try to get this breath into the belly. Good work. Now, tune in and notice that when you breathe in and your belly gets bigger and you breathe out and your belly gets smaller, you're not forcing that to happen, right? It just kind of happens. Your pelvic floor muscles, which are that little hammock between your sit bones, if they're truly relaxed, they should also move in the same way. So as you inhale and your belly gets bigger, your pelvic floor muscles should blossom downwards towards the surface that we're sitting on. The vag, rectum, and urethral parts all kind of blossom down. And then if they're resting at a perfect length, you exhale, the tummy gets smaller and the pelvic floor rebounds back to that ground level. Only most of us have some amount of stress in our lives. And so most of us, that pelvic floor is resting on the second floor, or the fourth floor, or the roof. So we're going to inhale and the belly's going to get bigger. And you're going to try to feel those pelvic floor muscles coming down towards the chair surface, down towards your heels. You're going to exhale. The belly's going to get smaller and your pelvic floor is going to stay relaxed. And it is a very modest, very demure movement, very tiny movement, but an important one. Inhale, pelvic floor drops down towards the seated surface. Exhale, it stays down. That is directly countering the body's subconscious tightening of the pelvic floor muscles that it will do to stress. And if you do one thing during your pregnancy to support your own health, it will be this: relax your pelvic floor. Now, the second thing, since I just said baby's going to be growing micron by micron, we need to make sure that we can connect to and engage the deep tummy muscles very gently while keeping this pelvic floor relaxed. So we've got the pelvic floor closer to the ground level. Can we find a cute little muscle between our belly button and our pubic bone and pretend there's a baby in there? If there's not a baby in there right now, can we hug baby up towards our spine with just our tummy, but leave the pelvic floor touching the chair? So wicked hard, isn't it? And this little thing, supported breathing or active abs with a relaxed rectum, active abs and breathing. This is a little bit of what we're going to do every day during our conception journey and during our pregnancy journey, and honestly during our 4th trimester, because every day our body's changing just a little bit differently. So we're connecting to that new body. Third and final exercise, relax those tummies again. We're going to look at an actual Kegel. And if you guys looked at any of our promo material, we said the Kegel is the least important. And now you kind of understand why, because most problems are caused by that pelvic muscle being too tight, not too loose. So but the reason we do a Kegel is we want to make sure that you have better access to the motor plan for that exercise prior, where we engage the abs but keep the pelvic floor relaxed. So sitting on these chairs, can we lift and squeeze vag, rectum, and urethra up away from the seated surface? And if we were on a towel, it would just be lifting the pelvic floor away from the towel. If we're on a couch ball, we're just lifting the pelvic floor. And if I look out and I see like this, those are your glutes. So right now you guys are all perfect. Nobody's doing bouncing. That's awesome. Now here's the more important part. Can you relax the pelvic floor? And that's the weird part, that when you actually think about it, it's like, well, I don't know. And now soften your tummies and take a couple belly breaths. And as soon as you soften them, you'll feel the pelvic floor come back down. And this is the truly amazing thing about our bodies, is since it doesn't realize that it was holding it up here in the 4th floor, this may have happened for months or years. We just showed it that with relaxed breath, it can shut down and calm down back to healthy. And now it's starting to recognize that. So when you do a Kegel, it's Kegel, 3, 2, 1, and then relax, which is the more important part, 3, 2, 1, and then a couple belly breaths. So those are what I call the big 3. And you guys that are here watching, you can talk to me afterwards and give me your email. I can send you a video of that. If you're watching it online, you can email us. But the key thing in pregnancy is the single most important thing is to relax the pelvic floor, and then to learn how to keep that pelvic floor relatively relaxed while the tummy does 2% more work. The typical question I get right here is, well, Kelly, I follow Samantha on Instagram. Sorry if there's actually Samantha out there. I'm trying to make that up. And Samantha says I should never tighten my tummy. And Samantha has to say that, depending on what her training is, because she recognizes that the tummy and the pelvic floor are linked in a lot of people. And so she wants you to keep your pelvic floor relaxed. I have more training than Samantha. I'm a double board certified doctor of physical therapy. I believe in your body. And I know that you can first and foremost down train the pelvic floor back to where it's meant to be and still learn how to use this tummy well. That's how I get to say this, because I believe in you and I believe in my ability to train you to do this well. The other question, so that's the difference. And it's not a forever thing that we have to think about active abs, relaxed pelvic floor. It's a rehab or a prehab thing. So we would do it during pregnancy. And again, in the 4th trimester, possibly depending on our postpartum journey, like maybe the first 6 months until the body comes back to its normal resting tone. But then we don't have to think about it anymore, which is really cool. That patterning of active abs, relaxed pelvic floor, it also does protect us as much as we can from pelvic organ prolapse and symptoms. So a pelvic organ prolapse, if I'm the bladder and here's where the pelvic floor is supposed to be and here's my tummy supporting me, if my tummy stops supporting me and then my pelvic floor gets real tight, I'm squished, I'm going to go into the path of least resistance, which is the vag, and I'm going to feel pelvic pressure and I'm going to get P urgency. But if I can relax and tighten, yay, I'm happier. And then in delivery, And the question of what's safe to exercise in pregnancy, whatever feels good for you and you have energy for. There are studies that show the higher intensity exercises do have a little bit of greater protective benefit for mom and baby from a mental health perspective. But I mean, I was sick as a dog my whole first pregnancy. So yoga was all I could do, and that was still a benefit. So, listen to your body and do what you can. Diastasis recti is a separation of your tummy muscles that any human who grows a baby more than 36 weeks will have some degree of. It's something that's going to happen, and don't worry about it. If we can do this gentle drawing in with the relaxed pelvic floor, we pretty much minimize or eliminate all symptoms with that, to be honest. Postpartum, the symptom of either the bulging or like a coning, it's called, or like a crevice in the middle, we note that, and that tells us in a lot of ways that activity is like at the limit of our strength. But it's not necessarily that that's an unsafe activity, because we want to get stronger again, but let's work on our motor control with that activity. And that's something that a personal trainer who has experience with the prenatal or postpartum population or a physical therapist can help you with. I have some good online courses too, if getting to a physical therapist or a personal trainer isn't accessible. But just know, like, don't freak out. And it's a lot of the newer studies, they say actually even the distance of the gap doesn't even matter. Like, they'll measure ladies who have a very visible gap and are perfectly functional, and other ladies who have a closed tummy, perfectly functional. A lot of times you will see the gap change though when you improve your coordination. So it can be a useful thing to use to like measure if an exercise is okay for you or not. But if you have questions, reach out to somebody so we can put you at ease, because the last thing you need to do is be nervous as your body's going through all these changes. Finally, delivery. Okay, we talked about the relaxing of the pelvic floor. If we can think about that a little bit every day, and especially if we can do it on something like a couch ball or a rolled towel. This is the inside of the pelvic. Oh, where's my moving one? Yes. Ooh. Here's the inside of the pelvis that baby is going to come down and through. Baby's head is going to push this way. Couch ball is about the same size pushing from the bottom. And yes, it's not going all the way through, but it's a perfect thing to sit on and practice relaxing into. And the key thing with any pregnancy preparation or push preparation is, just like your bladder pushes your pee out and your colon pushes your poop out, your uterus should push your baby out, not you. So your job is to relax in the presence of very intense sensations and contractions, and move between the contractions. And then when they come, we relax and we surrender and we try to suffer as well as we can. And
Suffer as well
as we can. And it is, and it's a very different feeling. And especially really athletic women, really driven women with anxiety, we love to be in control. And delivery, you're not in control. And so that's where a lot of this preemptive pelvic floor meditation and relaxation can really come into play. And the softer the pelvic floor is, the less it will impede baby. And if you end up needing an epidural, you have not failed. If you end up needing a cesarean, you have not failed. You prepare your body as best as you can, and then we put ourselves in a situation that we are cared for whatever that outcome might be. I wanted to have my first baby at home, and it didn't work out, but then I chose to have my second one in a hospital, and it was the perfect setting for me that second time. I wanted an epidural like starting at like 30 weeks. They want to give it to me. And everything went great, but I liked being at the hospital, just knowing that I had access to anything that I might need. In general, for positions, earlier labor, when you first start to have to like stop for the contractions, knees open, will open the pelvic inlet to help baby settle down. Later in labor, knees together will open the pelvic outlet to help baby make the exit. So once the contractions are a minute or longer. We switch to like knees in, heel out positions. I have a really fun little online course, Push Prep, that goes in detail to all of these. But again, as specific as it is, earlier labor, knees out, later labor, knees in. We try to relax our pelvic floor during the contractions, and you're already more prepared than I was for my first baby. Like it's pretty amazing, you know, how much more we can help ladies.
I love, yeah, that's amazing.
Yeah, and it was, you know, and I was a pelvic PT, Linz, 10 years before I had my first baby, but I just did incontinence and pelvic pain. And I went to the hospital class and it was like, here's where you give your insurance, here's where you get in the wheelchair, and like that was it. Like, no wonder I had a terrible birth experience at first. And that's what motivated me actually to make Push Prep, was I was like, oh gosh, this can't happen to anyone else.
Push Prep sounds amazing. Like I need to watch that.
Yeah, oh, you do. It's incredible. And just like the things that it includes too, like it's visualizing the relaxation of this pelvic floor and okay, where do we hope to have the baby? Okay, what would be less than ideal? Like, am I having my baby as I'm going over Teton Pass?
I don't know.
I
My like.
I know, I know. But it's like, okay, but if my brain at least like is like, okay, well, that might be an option. Then if that happens, it's not as foreign to my brain and my body doesn't react with such an anxiety response. And that's again, that's part of it, is when we think about a thing, not that we're like catastrophizing or like what's the word when you like focus on a negative thing all the time? Is it catastrophizing?
No.
Yeah. Yeah, you know, or like thinking like worst case scenarios, but like, okay, well, that would not be great, but what would I do? Okay. And like, okay, what if I end up at this hospital instead of this one? If my brain's already thought and been there, my brain's already been there once, so it's less scary and my body's going to react a little bit more normally. So that's the pelvic floor basics in a nutshell. Before we go over to the nutrition, do you guys have any questions? And you can also ask them later if you want.
I read there's a lot of pros and cons to getting epidurals.
Pros and cons to epidurals. Excellent question. So in America, where do we start?
Yeah, that's such a question.
There are and because you guys are here watching this, you are already in a great position, right? Because you're out seeking excellent care and information. We have a history of not taking care of our women in labor and delivery. And is unfortunately with some recent changes to laws, there's changing in where women have access to skilled OBs. If I show up to my OB at 38 weeks with my first pregnancy and I want to have the baby today because I want to go on vacation in 2 weeks, or my OB wants me to have the baby today because she wants to go on vacation tomorrow, or he, right? And so they're like, well, we'll just induce, it's no big deal. It is a big deal. We don't want to induce for no reason at all. If you are a high risk pregnancy, yes. If we are a C-section and for some reason we are wanting to induce at a certain size, absolutely. With valid reasons, totally okay. But for no reason at all, just for convenience, the whole body system is not necessarily set up to respond to that induction right there if there's no other outward signs. So in cases, to answer your question, when the epidural has been started at like 2 centimeters, when I don't even feel any pain yet, right? And just because like, oh, okay, I'm gonna do this because I don't want to feel any pain. That can slow labor a little bit. However, and then sometimes they'll say that will lead to, the word is cascade of interventions. And now that my labor could have slowed from the epidural, now I'm gonna need help to make my contractions get bigger. And then my uterus might fatigue and I might need further intervention. That's the worst case that you will see all the time if you Google cons of epidurals. In reality, if you are having your baby and you are hurting and you are tired and you're like, I don't know if I can do this, the epidural can save your life. The epidural can allow you to have the natural birth of your dreams. That was me with my first baby. Without an epidural, like we probably would both be dead. I mean, I'm exaggerating a little bit, but it's true. It allowed me to sleep. It allowed my uterus to push him down. His head was against my sacrum. That was the problem. So my sacrum wasn't letting him come down. had I known about relaxing my pelvic floor, who knows? But regardless, the epidural let me sleep, let labor progress naturally. And if a woman is in uncontrolled pain, that is going to cause the pelvic floor to tighten. If she gets anxious enough, that will create another cascade of chemicals that will stall labor. So it really is this balance point. Like if we can suffer well enough, yeah, lots of ladies can have a beautiful, amazing pregnancy without an epidural. Lots of ladies can have a challenging pregnancy without an epidural, but there is a subset where that's really helpful to have if you end up needing it. So I do feel it's been a little vilified in literature. So I think if you surround yourself with a trusted medical network who you really, trust your midwife, trust your doctors, and then have a birth partner who's looking out for your own best interest, then you can trust in the recommendations of the staff. And then also, if you're more relaxed with the epidural and it allows for an easier birth, then it's an easier recovery because there's not quite so much muscular strain as well. So it can be an option. I am not in general going to be totally team pro or anti. It's an individual choice. For me personally, epidural all the way. I'm a giant sissy. I don't ever want to feel pain. Ever. I think I'm done having babies. Which my husband said, oh, yes, I do. We'll talk to my husband about that.
Yeah.
He's open if it's only one. But I'm old and multiples run in my family.
Ooh, okay.
So I want a puppy.
So twins are next. Okay.
Great question. Any other questions from you guys that are here? Okay. All right. Nutrition for preconception and pregnancy.
All right, there's so much here again, like I had last time. So once again, I'm just reading all of my notes. So I think the biggest thing, so we're gonna start with just preconception. Our developing follicles, immature eggs, they have been developing for almost like if we're in our current cycle right now, they've been developing and maturing for 3 months. And so anyone who's thinking about conceiving, really think about your diet and your lifestyle, because even up to a year, I mean, as long as you can, just, yeah, there's so much you can do at that point, but at 3 months minimum is when our immature, eggs, are developing. So that's the first, I think it's the biggest thing when you're thinking about preconception and conception, as a holistic, from a holistic perspective on its own.
And sperm too, like.
So, yeah, and so, well, that's a different issue, Kelly.
Sorry, I know we said women's, but
We're doing females right now. I know, yes, sperm and egg development are a very nutrient intensive process.
Okay.
And we could do an entirely separate talk about sperm at some point if you wanted to, and male nutrition. We happy to do that. And I know you can do a ton of stuff, talks on male pelvic floor work.
Okay.
But right now, focus on females.
Focus, Kelly.
Yes, so as a reminder, so sperm and egg production are a nutrient intensive process. And I've mentioned this last time, oxidative stress. And oxidative stress is when there is an imbalance between harmful molecules in our body and our ability to neutralize them. And over time, this causes a lot of damage in our bodies. And we'll get into that more in a few minutes. So as a whole, there is no perfect fertility diet. Like over the decades since we've become, more and more into science and nutrition and whatever else, there's been a lot of back and forth on different diets that might be good for fertility, but none of them are super conclusive, and they change every month or year, whatever. It's like, this is better than this, and this is better than this. As a general rule, like and there have been like very specific fertility diets, but as a general rule, if you can reduce like trans fatty acids, which are like fried foods, reducing like carbohydrate, our overall daily carbohydrate intakes, replacing animal proteins with vegetable proteins, beans, seeds, quinoa, and also just like margarine and processed foods. Get those out, we don't want any processed foods. Those have all been shown to overall have a general positive effect on fertility outcomes.
That's so cool. And that's with the oxidative stress. Mostly it's just easier, it's healthier to digest, so there's less inflammation.
Less inflammation, yeah.
That's so
And
cool.
we'll get to that, yeah. And so again, yeah, no like huge major, like this is the one fertility diet you have to do if you're trying to conceive. And there are also a lot of herbs that throughout this entire journey are really good and really bad that you should avoid or take, and even down to our monthly cycle between our follicular phase and our luteal phase that you should and should not take. And so I don't want to get in the weeds into, you know, and all the herbs in this talk. I have a lot of handouts and you can reach out to me, and I've listed a bunch of resources that you can refer to in my handouts. If that is something that you want to, if herbs are something you want to take during your pregnancy or trying to conceive, but you have to be very careful about it. So anyway, every part of the cycle, this entire journey, very different.
That's so cool.
Just want to make that clear. So preconception is very different than trying to conceive. It's even different. So when you are actively trying to conceive, there are even more different things that you should be doing. I would just want to start with like environmental toxins. No brainer. Avoid BPAs, which are in like canned products and even in some water bottles, phthalates, vinyl fluorine, cosmetics, personal cosmetic products, pesticides, heavy metals like lead and mercury and nickel. We want to try to use eco-friendly products that aren't scented and don't have any fragrances. Organic cotton or reusable menstrual products, which Kelly can talk a lot about. That's very important. Again, if you're trying to conceive, we really want to just be as natural as possible. There's a website that I personally really love, the Environmental Working Group. They list a ton of things, which again, I've listed on my handout. They have they rate everything, all products, and so if that's something you're interested in, check it out. We want to try to store foods in glass containers or porcelain or not plastic. We want to avoid plastic. We also don't want to microwave anything in plastics. We would love to not use a microwave in general, right? I haven't had a microwave in my house in like 15 years and I love it. That's super important. We want to use like nonstick pans, like stainless steel, or cast iron. We want high quality water. And again, the Environmental Working Group has a list of their top water filtration systems, and even our local what am I thinking of?
Health department?
Yes. You might be able to help test, like if you have a well, and you want to get your water tested, they might even be able to like financially help you with that. So that's also really important to get tested, like if you have a well, whatever. And then also exercise in like really high quality air. So like stay away from, if we have fires here every year, right? We don't want to go outside those days. Just stay away from, stay indoors, do whatever you can, just exercise, and exercise is super important, but high quality air is what we want. So supplements when you're trying to conceive. The best prenatal vitamin is the one that you can stay the most consistent with. Like there are a lot, like there's so many, and we all get in our heads about it. Like, well, what is the best brand? Like, I don't know, blah, blah. And they do vary, but it's just the most important thing to stay consistent with them. And more is not better, so definitely always follow the recommendations on the bottle. Like if it says take one supplement per day, don't pop 5 thinking you're gonna just like enhance your body. It's not really the way that works. And it's never too late or too early to start taking a prenatal vitamin. So again, like 4 months to even 1 year before you even thinking about conceiving does not hurt. Do it. Folate, super important. Iron, I've listed specific dosages on my handouts, and you guys can all reach out to me if you want specific dosages. We don't have time to go into all that, but just yeah, again, when you're trying to conceive, like folate, crazy important. Iron, vitamin D, super important, and also vitamin D decreases chances of preeclampsia.
Yes.
And it's associated with increased fertility rates and associated with decreased miscarriage rates. I'm gonna go into this more in just a second, but
It is so cool.
it's so freaking
It's
cool.
like the miracle like vitamin / hormone type vitamin. Like,
It really is. It really is.
Mhm.
And just because Kelly had mentioned preeclampsia to me earlier, things like olive oil, broccoli, beets, carrots, collard greens, kale, fiber, all of this, you want more poultry, more fish, seafood, well over processed red meats to help with decreasing the chance of preeclampsia.
And I didn't actually say what it was. So just in case you guys don't know, preeclampsia is like one of the more serious potential complications of pregnancy. It can happen in the late 3rd trimester for a lot of different reasons, but it's past a certain point in your pregnancy, having an elevated blood pressure, the presence of protein in your urine, and it's a medical emergency. And sometimes it can be controlled with medication. Sometimes you have to deliver the baby right away. And if we can avoid this, we really, really want to. And it's even possible to happen postpartum, which is a fascinating thing. So
Yeah.
anytime you or one of your lovelies have a headache, if you're not being listened to, if your blood pressure is not being monitored throughout pregnancy and or in the postpartum period, you need to get your butt to someone else who will listen, because it's something that's important, but if caught, can usually be treated really successfully. But if we have this headache and we're not checking our blood pressure, and we're not checking our urine for protein, we could be in a bad way. So we want anything we can do to reduce the risk of this, we want to. And nutritionally, it's the biggest, and exercise, but nutritionally it's the biggest things that we have power over to do.
Yeah. Did you have that in your pregnancies?
Oh, no, sorry,
Oh.
I'm sorry, I have it in my courses. No, I never had preeclampsia.
Okay. No, I'm just curious if you personally had dealt with that.
Sorry, no, but I have treated
It's
lots of,
huge though. Yeah.
lots of ladies who have been on like bed rest and
Yeah.
things and just asked, so we
Yeah.
want to avoid it if we can.
Yeah, absolutely.
Mhm.
Yeah, and then so other supplements like choline, omega-3 fatty acids, huge. CoQ10, big deal. We'll get to that in a few minutes. Probiotics. Cannot say enough about this. I used to just be like, I'm never taking any supplements, I'm never taking any probiotics, I've got it on my own. This is so huge. So you want to get a female probiotic that supports not only your gut, but your vaginal microbiota.
Okay.
And that it definitely exists. It creates a welcoming environment for sperm, for one. For two, the pH in our entire body, gut and our vaginas, are so important to actually conceiving and actually having a healthy birth. And so the vaginal microbiome can have an effect on the success of conceiving. And if we have vaginal dysbiosis, or when our pH is off down there, the success of conceiving has been associated with poor outcomes to fertility and conceiving.
So interesting.
And so yeah, if you do like douching methods, if you have yeast infections, if you're using an antibiotic, even if you're using boric acid, which is a more natural method, that is going to throw off your pH down there, and that is going to affect your ability to conceive.
So
And
don't do
all the above.
take
Just
probiotics.
do it. Yeah, be proactive. It's really important. And also, like, sperm does not like acidity, and it needs a lot of nutrients. And so yeah, sperm's not going in there if we're off. So that's really important. And also the lactobacillus strain, in particular for any probiotic, is going to be extra helpful if you are trying to conceive or if you are even actively pregnant.
Lactobacillus just in general, or a specific strain of lactobacillus?
In
Bacilli.
general, yeah,
Perfect.
yeah,
Thank you.
in general, and there's like 4 different ones that I have written down, if you really want to have specifics on it, but yeah, and then there's just a lot of different herbs. Again, we need to be very careful about that. I'm not going to go into detail too much, but green tea, again, if you're trying to conceive, nettle leaf, you can make infusions at night. There's a ton of stuff you can do. And again, it's important to note that when you are actively trying to conceive, you need to be more cautious than if you're in the preconception phase with herbs. And if you do end up getting a positive pregnancy test, the most important part is to try to stop taking your herbs for at least the first trimester. And after that, there's a lot of different things going on. So again, I'm not gonna get in the weeds on that. Let's get into pregnancy.
Woo! Pregnant ladies in the house.
Yeah, so in general, once you were pregnant, and congratulations. So exciting.
That's not bad.
You want to just kind of focus on just taking like a multivitamin daily, and then other prenatal supplements like choline and iron and omega-3s. Again, I'm not going to list, everything, but it's all in my handout, for daily dosages. Okay, low water or beverage intake per day is a huge deal. It can cause constipation, preterm labor, early miscarriage, fatigue, like all kinds of stuff. Like we have to make sure that we are very hydrated when we're pregnant. It's recommended to drink 8 to 12, potentially, hopefully 8-ounce glasses of water per day, when you are actually pregnant. And this will also subsequently help with your milk production and flow. So super important. As a general rule, we want to have around like 175 grams of carbs per day, 71 grams of protein per day. I have a ton of resources if anyone wants it, as to like Lindsay, like how do I make my daily, schedule of food, and like I can help you with that. I can lay it out for you.
I still need help with that, Lindsay.
Yeah, well, for starters, lentils, 1 cup of cooked lentils per day, that is 40 grams alone of carbs. I mean, it's as simple as that, but I can put a full, menu together for it. Yeah. Soy is controversial in pregnancy. We won't get into that. We want to typically try to avoid flaxseed, caffeine, cacao, peanuts. They should all kind of be generally avoided even before actually getting pregnant. Fish is super beneficial to the fetus and to the mom and the immune system, and preventive him with other conditions as well. Big fish equals bad. We don't want big fish. We want to avoid big fish. Mercury is obviously a huge concern. The biggest fish are like tuna, halibut, bass, even like lobster. Small fish are better. So, unfortunately, farmed salmon, typically don't have mercury. So,
So they'd be better.
they'd be better.
Okay.
So not wild. Trout, rainbow trout, sardines, that kind of stuff. Sleep is huge. Quality sleep is huge. Anything less than like 7 to 8 hours, it can really have a lot of effects on you guys. So, yeah, like risks increase in miscarriages and promotes postpartum depression. Big deal. Exercise is also super important. Except if the mother has like high blood pressure or asthma or risk of, miscarriage. There are safe exercises that you can do, like just walking or swimming, yoga, things of that nature, to be safe.
Call me if you have
Cycling.
questions.
Yeah, call Kelly. Oh, okay, this is what I was getting at with vitamin D. Sunlight. Prenatal sunlight can determine birth length and height and has so many other beneficial outcomes. And the benefit of getting vitamin D from sun exposure well outweighs getting vitamin D from your foods. So I know we live in this area where
So get
we're
out your
not getting a
bikinis,
lot of
ladies.
sun in the winter, but, and we don't want to burn our skin all day, you know, we have to consider that, but, yeah, that was a really interesting thing that I learned a while ago, is like, actual sun exposure gets you, it's better for your fetus and for the, you know, mother. Yeah, super cool, really good to know. Yeah, and then again, just avoiding like environmental exposures like the BPA, even like cell phone radiation and air pollution and all this stuff. It's like, sorry, my cell phone's right there. Oh no. Oh, well, okay. It's not on you. We don't want it like on our ovaries, right? We don't want it on our uterus. We don't want it in our back. We don't want it in our back pocket. We don't want to be sleeping next to our phone with our head. Like, put it in the next room, turn it off, put it on silent for the night. That's super important. Supplementation, again, like folate, fish oil supplements. Apparently, that might actually than like eating actual fish, because we can take out the mercury or in any other toxins that are in actual fish. So if that's, you know, if we're wanting those omega-3s, that might be important.
Do you have any tips? Like, I have my little like bottle of cod liver oil, like, and it's awesome, and I take it, and it's super gross. Like, should I get a capsule instead of the actual just oil, or like, what should I mix it with to make it more palatable?
That's a good question.
Just sprung this on you, sorry.
Hold it. Pull your
I know,
nose.
that's literally what I do. I just put the teaspoon and like, and then just like drink a bunch of
It
water.
is like almost more nutrient dense than fish oil, omega-3s, but I don't. Actually, I'm blanking on.
I should have prepared you for that.
No, I'm blanking on like, I had to research this for a client, like a year ago, and
Well, you can email me and I'll.
I
post
will,
about it. So
yeah,
Look
no,
at
we'll
look at my
post it.
socials.
That's in her post. That's a good question though. Yeah, and it's pretty gnarly.
It's gross, but I'm
Yeah.
like, I know it's good for me, so I do it.
Yeah, but yeah, active pregnancy, folate, vitamin D, fish oil supplements, vitamin A, again, probiotics, choline, iron, this is another important point. Dietary changes made after you have the baby may not reverse what you've done or what you did not do, what you avoided while you were actively pregnant or even in preconception. Especially with like folate and various things. So it's really important to be proactive if you are thinking about conceiving.
Yeah.
Because yeah, there's like neural tube defects and things like that that you cannot reverse. Like, you're like, oh crap, I didn't take a prenatal. And again, it's not the end of the world, you know, like everyone does their best, but there are just some things that may not be reversible. So we want to be as proactive as we can.
Awesome.
Yeah, and again, with herbs, there are a lot of herbs that are great throughout the entire process, and some that are only okay for like 2 weeks in your cycle before you're even pregnant. So just make sure that you really reference everything. And again, I have resources, but just be careful about that. And then that's pretty much it. But I did want to just mention a couple of other things that I would be remiss if I did not mention. Statistics, even with perfect timing and everyone is super healthy, both partners are super healthy, it can take at least 6 months to conceive, if everything is perfect. And if you are under 35 and you do not conceive within about a year, it would be wise to seek medical help. If you're over 35 and you don't conceive within like 6 months, start seeing, you know, one of your doctors. And then if you're over 40, which a lot of us are, just keep seeing your doctor. Yeah, and then like per cycle, if everything is perfect, you have about a 30% chance of conceiving, and that means you guys are genetically perfect. if everything is flawless.
That's
So
amazing.
don't beat yourself up, you know what I'm saying? Like,
Yeah.
there's just so many different factors and going 30% chance per cycle. Yeah, and then, you know, I don't love to throw these statistics out, but just like if you're, in general, like fertility starts declining in your mid-30s for those who menstruate. So it's just a reality to keep in mind
Yeah,
and,
we
and
never
think
learned
about
about
it. You just have
this.
to, you know, be proactive. And then, yeah, just a couple of different testing methods for ovulation. There's a ton of information. This could be an entirely different talk, but luteinizing hormone or LH strips that you can get and use at home. It's you basically put urine on a strip.
Mhm.
I think it's the cheapest method and one of the most effective ways. If you haven't started tracking your cycle and you want to try to conceive, I think it's one of the best ways. And then you have an app on your phone and it looks at it and you can kind of start to track your cycle and like, okay, well this, I think I'm ovulating almost every day at like day 14. And that's like one of the easier ways to, you know, to start ovulating, you know, it's seeing if you're ovulating. And then once you kind of understand that, yeah, like LH starts to rise like 36 hours approximately before you start to ovulate, and then it peaks like 10 to 12 hours. And it's very, you know, it can be very nuanced. Like tracking your cycle is amazing and crazy and confusing, but I also have a really good tracker here. And I can email it to anyone, but it has every different method of tracking your cycle that you could possibly log. And so, yeah, and then we've got like cervical fluid is huge. And like basal body temperature, also huge. There's like wearables, like bracelets and rings. Some of them you wear overnight. A ton of different stuff. And then you have fertility labs that you can do as well. And those are very specific. You want to do them on very specific days. So there's like day 3, day 7, and then there's other one like hormones that you can test any time of the month. But that can tell you a lot of different stuff about your ovulation, your cycles, and your hormone levels and things like that. And again, that's just very nuanced. And then also imaging. We've got MRIs and like tons of different ultrasounds at this point. I mean, it's just there's so much you can do. And so I just would be again remiss if I didn't mention that. And then there's also support for females that are trying to conceive that are like above 35 years old. And there's a ton of support that we can do there for them. Again, like our gut and all of our microbiota and our vaginal microbiome, that all changes as we get older. And it's super important to support that and to focus on lifestyle factors, and we just have to focus on it even more. CoQ10 as a supplement, super important as we age, because that is going to increase our ability to conceive. It's also going to protect all of the oxidative stress and everything else that's going on in our bodies and preserve egg quality and increase the chances of conceiving. So that would say, you know, if we are older and we're trying to conceive, the CoQ10 supplement, super important to take every day, all day. I mean, yeah. Yeah, and then again, pH, gut and vaginal pH, super important. And barriers to conception, there's a ton of that. Again, it could be another talk. PCOS is a big deal. And also endometriosis, and there are definitely supplements and herbs that we can do for that stuff. And then also assisted fertility, again, another one that there's a ton of supportive things we can do for that as well. That we don't have time to talk about, but yeah, there's just a lot of routes we can go. And so
Absolutely.
just want to mention those,
Yeah.
and I think that's
Cool.
what I have. So,
Any questions about the nutrition? There's a lot.
it was a lot. I know, it's
You're
so
perfect.
much. It's so
That's
much.
so good. Oh, one thing about during delivery, if allowed, which it should be unless there's extenuating circumstances, you want to try to drink at least 2 or 3 ounces of water every hour and ingest 100 calories every hour. Delivery is an endurance event. It is not a sprint. You would never run a marathon without drinking any water or without eating anything. If you are not allowed anything oral, if you are NPO, once they put your epidural in, they can still give you a sugar solution through your IV to keep you hydrated and to keep you nourished and consequently baby nourished. The last thing we need is baby to have no blood sugar when they come out of the womb because they're exhausted from the birth effort. So that is something that the birth partner can be in charge of. They can just have a little checklist. Hey, we drink at least 2 or 3 ounces of water, which is honestly in the low end, but whatever, every hour, and did we ingest 100 calories? We can make cute little bags, this many natural gummy bears, this many chips, this many papayas. Who knows what you're actually gonna want to eat during that time?
Wait, are you actually NPO when you get an epidural?
Often you are,
No way, okay.
because it's, and
Wow.
it's again, that's a little bit of the it should not necessarily be that way if everything else is progressing well, but in many hospitals, because of legal reasons, as soon as they put an epidural in, they may not allow you to eat or drink anything.
I mean, I guess imagine most
And that's a
females would not want to eat anything.
well, but you need to for
But you-
energy.
yeah,
So
you better-
that's again, it's something that
Yeah.
you might not know, and that's important
Yeah.
to do for your
Yeah.
Okay, well, I'll go ahead, I'll stop the streams here, and then you guys that are here, we can answer more questions if you'd like. Thank you. Do-do-do-do. Don't know how to stop this. We go.
Spiritual and
Oh my
spiritual.
gosh, yeah, stop.
I have a question. I've been hearing the term